Well, welcome to the Restore PDX training videos. These are meant for internal use within our company and clinics. They're designed to inform our scribes, MAs, and students who are interested in working here so that we can all have a standardized practice on how we examine our patients and how we report those examinations in our charting. It's really important for the scribes to keep track of pertinent negatives. So sometimes the clinician will be examining a patient and they will not remark on any of the exam because the exam is negative. They don't have any positive findings. Now, in that case, they still assessed, let's say for the shoulder, they still assessed the range of motion. They just didn't call anything out because there was no limits. We need to document the pertinent negative that the range of motion was within normal limits. If we don't document it, we didn't examine it. And that is a medical legal important thing to capture, so that when we're examining a shoulder, the first thing you do is assess the range of motion. And if we didn't document it, then it looks like we didn't do our jobs as providers. Now, as providers, sometimes we will modify exams. We won't always do the same flow, but we're trying to standardize that. If you're familiar with the exams, then it will help you be able to keep track of what we're doing, find the pertinent negatives, document them correctly, and go from there. In our electronic medical record system, IMS, the basic exam template is designed to follow each anatomic area and the standard exams that the providers will do for those areas. That's why I recommend using the basic exam template for all of the exams that you document. Sometimes people will try to capture only what the physician calls out. So they'll only capture in a notepad the positive exams, but that leaves out a lot of the pertinent negatives for which the provider examined. We need to make sure we capture those. The IMS system is a very easy system once you get used to it to capture both the positives and the negatives. So I recommend that with these exams, with these videos, we'll be showing you how to chart them in the IMS as they're being done. So if you follow along with your provider as they're doing the examination and click the pertinent negatives if they're not calling anything out, but you know what they're examining, it'll help our practice, it'll help our chart notes be more robust, and it helps the clinicians as we move forward to review what the exam was. If we only have the positives, we look back, we're like, did we even examine this? Well, yeah, we probably did, it just wasn't documented. Ultimately, a good documented note will be beneficial for the patient. Patient care is the utmost importance at Restore PDX. Documenting what we've done allows us and allows the patients to take this documentation and this exam provided by a specialist to wherever they need to go to get the care that's appropriate for them. So please take some time as you're onboarding with Restore PDX to watch these videos. We're going to do a video per anatomic area, and I'll try to stick to a normal flow that will be very familiar to what you get in clinic. And take some time to familiarize yourself with the IMS template of the basic exam so that it makes it, from day one when you're in the clinic, it makes it easier for you to jump right on board. Thank you.